Hello, this is Dr. Trivedi, a doctor working here today. May I confirm your name and age, please?
Hi, doctor. My name is Sherin Arul and I am 30 years.
Okay, how may I address you?
Please call me Sharon.
Okay, Sharon. Today we are going to discuss about your health issues. Is that all right?
No problem, doctor.
Okay, during our conversation, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Okay, Miss Sheril, can you please tell me in your own words what has brought you here today?
Okay, doctor. About 2 weeks ago, I had an operation at my uterus. After that, I was almost fine, except that I had some pain at my cutting area. Otherwise, it was fine. But for last week, I noticed that I have some sore throat. I have some cough and also I have some body ache, that is some, and also some malaise. And in the meantime, I noticed that I have pain in my chest, especially on the right side. That wasn't severe initially, but for last 2 days, the pain is much worse. And even when I cough, I feel the pain more.
Okay. Well, I'm sorry to hear, but I'm I'm going to try my level best to find out the cause today. Okay. Can you please tell me that you had some sore throat around? Uh, can you please tell me when did this sore throat started to feel?
About 1 week.
Okay. And the cough also came along at the same time.
Yes, almost the same day.
Okay. Can you please tell me that did you have any raised temperature at the time?
I feel feverish, especially at night, not all the day.
For how long?
Maybe for the last 7 days.
Okay. And okay, any sweats?
Yes, doctor. Sweating also, that is somewhat unusual for me. That is also at night.
That is also at night. Okay. And okay. And can you please tell me that whether the cough is productive or non-productive?
So what do you mean by productive? I see
Okay.
that.
Is it dry? Is it dry cough, or do you have any phlegm?
For last 2 days, I noticed some flame.
Okay. Can you please describe it for me about the phlegm? Is
Uh,
it thick or thin?
it is somewhat thick and it is in color is somewhat greenish yellow.
Greenish yellow. Okay. And its color greenish yellow. Have you ever observed any blood in it?
No.
Okay. And what about okay? And uh, so at the beginning it was dry for the first 5 days.
Yes.
Okay. And you told about body ache. Did it start at the same time, around 7 days back?
Yes, doctor.
Okay. And is it in the whole body or in its specific parts?
No, all over my body, especially my muscle.
Okay. Okay. Is there any specific type that it gets worse or better?
No, just taking some paracetamol makes it better, nothing else.
Okay. And okay, that's all right. And okay. And you told about pain in the chest. Can you please tell more about it? When did it start? This pain, chest pain,
Uh, that was initially mild, but for last 2 days it is somewhat severe. I even
for the
cannot
last
take
two
deep
days.
breath.
Okay, you cannot take deep breath. Okay. Can you please tell where is it in the chest? This pain?
It is on my right side.
Yes, you told it before. Does it spread to any other side or just in the
No,
right
no,
side?
just on right side.
Okay. Did it come along? You told, although you told that it was mild, but can you please tell me that did it come along suddenly or did it develop gradually?
Uh, I think it came gradually.
Gradually, it's all right. And can you tell me that for how long does it persist, this chest pain?
For 2 days, it is almost always, especially during my coughing or during taking deep breaths.
Okay, that's all right. And okay, so it's very frequent now for the last 2 days. Am I right?
Yes, doctor.
Okay, is there anything that makes it worse? You told that deep breath makes it worse. Anything else?
No,
Okay, anything makes it better?
no.
Okay, do you have any noisy chest?
Actually, I have asthma for a long time, and for that, I take steroid inhaler. And first, I thought that my coughing, and I have also developed some shortness of breath, and I thought that this was due to asthma attack. I was taking more than normal inhalers, that is serotype and Ventolin.
Okay, okay.
That is
And
helped initially a
yeah,
little. Yes,
okay. Well, okay. Do you have you always been taking this inhaler?
yes, doctor. After the diagnosed with asthma.
Okay, okay, that's all right. And okay, and any other any racing and pacing of your heart?
No.
Okay, and any shortness of breath?
Yes, doctor. Told you that shortness of breath for the time being also.
Okay, can you please tell me that how long can you go now without feeling shortness of breath?
I can do my works, but I for my after operation I am not going out for a long time. But if I work for a while, I feel the shortness of breath more.
If it's okay, and do you have any swelling in your legs? Have you observed?
No.
Okay, do you think that you have to use the extra pillows
No.
for shortness of breath? Okay, and okay, and well, you told that you had some operation 2 weeks back. Uh, can you please tell me that for how long did that operation undergo? Can you know any of it?
Maybe about 1.5 hour.
Okay, that's all right. And mm, after that operation, for how long have you been in the uh, hospital?
It
Had
was
you been
half day only.
half day? Okay. And after that operation took place, were you confined to bed?
No, I was allowed to work after 6 hours of operation.
Okay. And okay, after successful operation. Okay. Well, okay, that's all right. And were you prescribed any medicine or any medicine in your veins, through your veins or blood channel? Do you know of any?
I was given antibiotic and some painkillers.
Okay. And did you take it regularly?
During the hospital admission. After that, I am taking some. Now, currently, I don't take any medication except some paracetamol.
Okay. Well, after the operation, did you feel any pain in your legs
No,
or leg? Okay. And okay, that's all right. And did you previously had any history of clotting disorder, blood clots? Hello.
hello,
Previously, did you have any history of blood clots?
no, doctor,
Okay. Well, may I ask you some other questions now? Do you have any headache?
no,
Okay. Any rash anywhere in your body?
no,
Any changes in your vision?
no,
Okay. Any weakness in any parts of your body?
no.
What about your water work?
That is fine.
Okay. Any joint pain?
No,
Any oral soreness?
no.
What about your bowel movements?
I think it is okay.
Okay. And may I ask you that do anyone of your family have any such illness, any chest chronic disease or any chest disease?
No.
Okay, any history of sudden death?
No.
Okay, that's all right. And may I ask you some personal questions? Do you smoke?
Very occasionally, doctor.
Do you drink alcohol?
No.
Okay, again a personal question. Do you take any recreational medication?
No.
Okay, and do you have any past medical history? Any yourself have any history other than asthma?
Yes, doctor. I have also an operation when I was at 11. That was a appendix operation, and also I have a history of fracture of my left hand.
Okay, can you please tell me when that did that occur?
That was when I was about 17 years.
And how did that occur?
I fall from a bicycle.
Okay, okay, that's all. And you told that you're taking steroid inhaler. Well, have you been regular to the asthma clinic for your asthma treatment?
Yes, doctor. That usually
Okay, that's all.
was on good control, except I needed two times hospital admission, and last hospital admission was 3 years back.
Sorry, what was serious back?
Uh, I needed hospital admission, and last hospital admission needed about 3 years back
Okay,
for
and
asthma.
yeah, yeah, yeah. And may I ask you that what do you do for a living?
I am a school teacher.
Okay. Have you do you have any allergy to chalk? Have you ever observed that your
Yes, doctor.
problems
I am
in?
allergic to ibuprofen. I cannot take that, and if I take that, my asthma get worse.
Okay, that's all right. We will get to that. And can you please tell me that do you take any medication other than steroid inhaler on and paracetamol now?
I take a Ventolin inhaler, 2 minutes remaining.
Okay. Any other any allergy to any other drug other than ibuprofen?
No,
Any over the counter medication?
no,
Okay. Any herbal medication?
no,
Any recent blood transfusion?
no.
Okay. And can you please tell me that have you been to travel recently? Any travel recently?
That was about 1 year back. I went to India.
Okay. 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 And okay, that's all right. And can you please tell me that these are some private questions. Can you please tell me about your menses? Is that regular or irregular?
Regular, doctor.
Is it all right? The amount?
Yeah, there was problem, so I underwent an operation. I told you.
Okay, that's all right. May I ask you that do you take any pills or tablets for contraception
I am not taking currently, but I took before of my operation.
before your operation? Okay. And may I know that are you sexually active? This is again a personal question.
Yes, doctor. I am living with my husband.
Okay. Have you ever tried of getting pregnant?
No,
Okay, that's all right. And okay, and may okay, and may I know what your concern is?
why are you having this, doctor?
Yeah, yeah. Okay, and yes. I we can actually be sure about your problems after examining you properly and also assessing you. But at this moment, as long as we have taken history uh, from you, I think that you might be suffering
Time up.
from a condition named pneumonia. Okay. For I have to for that we have to do some blood tests and also some scanning tests of your chest. And if we find that positive, and also do some blood culture. And if we find that positive, we might have to give you some special antibiotics. Okay, to treat you. And we will also involve our consultant and our chest specialist. Will that be okay for you?
Do I need admission, doctor?
Yeah, at this moment, it's very important at the beginning to have some test and scanning tests and blood tests done. Okay, in the meantime, we might be observing you, and after getting the results, we can be sure that whether you need admission or not. Are you getting me?
Okay, doctor.
Any more concerns?
Yes, doctor. Is this condition
Okay.
related to my asthma?
Yeah, well, at this moment, it might be a bit difficult to tell you, but it after we can tell you after assessing you properly. Okay, it might or might not be, but we have to assess you at first.
Okay, doctor. My GP said that there may be some blood clot in my lung.
Yeah, yeah, we will also rule out that, but at this moment, as long as we have taken the history, we think that it is unlikely that you have any clotting problem in your lungs. But yet again, we will rule that out by doing the blood test and also scanning tests.
Okay, doctor. Thank you.
Okay, okay.
So, what are the differential EFF?
Uh, well, I think that it's the problems may be due to bacterial pneumonia. I think my first differential, and it also can be due to some atypical organisms like uh, Mycoplasma pneumoniae, and uh, also there is a possibility that it might be due to uh, due to some TB, I think, or some other. Well, I'm not sure, but some malignancies might be possible or not. I'm not sure.
Did you get any warning sign or any red flag symptom for malignancy?
No, not that, but actually she underwent, I think, a problem for the uterus, so, an operation. Am I right? Hello.
Okay.
I'm not sure. It's a very remote possibility, but he also has some. She also has some night sweats, although for a very short span. But I think that we might also have to do those scanning tests to rule out whether any malignancy is possible or not. But that's a very remote possibility, I think.
Do you think any infective exacerbation of asthma?
Yeah, it's very much possible.
Do you think it is case of aspergillosis?
Oh, I actually didn't uh, thought about it that way, but it's very much possible.
Any granulomatous disease?
Yes, I think that, but in granulomatous diseases like suppose sarcoidosis, I think there might have been some problems with his urination and also some skin rash. I think some problems in his eyes, redness in the eyes. So these would have been this could have been involved, I think.
Okay. So, how will you investigate her?
Yeah, well, at the beginning, I will have to do some blood tests, like CBC, then also ESR, CRP, and also check about his asthma control by doing the peak flow meter. And very importantly, we will have to go for chest X-ray PA view and also go for a blood culture. And then I will also involve the lung doctor to see whether any CT scan of the chest is needed or not, and after is needed or not, and also whether some specific antibody tests for specific organisms are needed or not.
Okay, that is fine. Can you tell the risk factors or are risk present with that points favors pulmonary embolism in this lady?
Favors.
Any points that
Sorry.
favors possibility of pulmonary embolism for this lady?
Well, actually, there is a pleuritic chest pain and shortness of breath. These are possibilities, and also she underwent an operation of around 1.5 hours. So that is also a possibility, I think, for pulmonary embolism.
Okay, fine. Thank you.
Okay.
So patient's main complaint was neurologic chest pain, shortness of breath, and along with she had other symptoms of pneumonia. That was
Yeah.
fine for the chest pain. You went well, but I think you should have asked about the severity. Was it very severe that needs urgent medication? You should have asked that.
Yeah.
If it was so severe, so you could offer her painkiller at the beginning.
Yeah.
And also, uh, she said that she is allergic to ibuprofen.
Yeah.
So she needed some opioid drug.
Yeah.
Okay, and another thing associated with pain.
What drug actually? She needed some what drug? Painkillers.
She was allergic to ibuprofen.
Yeah. You told it that I asked about drug allergies.
Yes.
Okay.
And after that, for her symptoms, I cannot remember. Okay, for pain, you have underwrite 2012. For shortness of breath, you try to exclude lung cause or heart cause. That was fine. He tried to find out the source of pneumonia. That was fine. And also tried to find out the risk factors for pulmonary embolism. That was also fine. Okay.
So may I know that what was the case actually? The most two important diseases are what infective exacerbations of asthma and aspergillosis.
Pneumonia and infective exacerbation of asthma.
Okay, and what about aspergillosis? Aspergillosis.
Okay, aspergillosis presents with actually uncontrolled asthma that is not controlled with frequent medication, but this was actually unlikely.
Okay, this is actually usually associated with uncontrolled asthma.
Yes,
Oh,
history of taking
that's
all the drugs regularly, but presents with uncontrolled asthma.
okay. That was a very informative, doctor. And well, in this case, what might be the actually what might be the cause of pneumonia? I couldn't elicit the basic cause of pneumonia in this
Okay,
patient. Can you please?
it can present with community acquired pneumonia. So there will
What?
be community acquired pneumonia.
Yeah.
There will be no source, or source is the community. We cannot tell exactly that what could be the source.
Yeah. Okay. That's all right then. So you're telling that
And
it's
also,
community acute pneumonia. Okay.
yes,
Okay.
and also
Okay.
for
Thank you. Thank you.
respiratory symptom, I think you should have asked about any pet.
Yeah. I actually missed that. I was just thinking about it. I was just in my mind and but just missed that. Okay.
Okay, otherwise I think it over 12.
Okay.
Our time is also up.
Yeah. So I think we can stop the recording for today. Okay.